Doctors of Reddit, what was your "this person is obviously freaking lying" / faking moment? I've tested the hearing of a few kids like 10 to 12 years old pretending to be deaf in one ear. All you do is turn on your microphone and talk in the deaf ear at a quiet level and ask them a question about something they care about. Like young boys, for example, always fall for it when you ask them what video games do you play at 20 decibels. Works every time. Not mine but my mother's, a nerdoc at the time, scruffy guy, mid-50s, comes in looking for non-specific help. Confused, smelly, dressed in ragged mismatched thrift store suit, clearly homeless and just looking for a bed. Keeps muttering something about quantum, obviously a little off his rocker. Mom decides, might as well give him a workup and teach the residents. Turns out the guy's in near total renal failure, so they give him dialysis. Snaps to suddenly coherent, suddenly sane, suddenly talking about real actual quantum physics. Turns out has a math professor. Some organ problem sent him into a mental tailspin on his way to a conference a month earlier. Got off train in wrong city. Been wandering the streets ever since. Missing and presumed dead. Fear not always faking. Had a part fake a ruptured ectopic pregnancy to get narcotics. Says she was diagnosed with an ectopic at another hospital and given medication to end it. Came into our hospital in extreme abdominal pain, rolling around, yelling, had vaginal bleeding, the whole 9 yards. Gave her a bunch of pain medication so we could get an ultrasound. Ultrasound showed nothing. Urine pregnancy test showed nothing. Beta HCG was 0. Turns out she was conveniently on her period, which made the whole thing very convincing. Got records from the other hospital. Patient had been there yesterday, but was not pregnant for them, nor was she diagnosed with an ectopic pregnancy. Definitely was a wow, she just made up this entire thing. We had a lovely conversation about all the results. She ended up screaming at me, threatening to sue me for all I'm worth and stormed out. Jokes on her, I'm worth minus 200k of student loan debt. M's here. Had a patient start seizing in front of the cops after they were pulled over for possible drunk driving. We get there, and patient is still on and off seizing. We get them on the stretcher, and in the back of the ambulance, surprisingly the cop joins us. As I take their arm, the shakes start up again, so I tell them, yo, if you want this medication, I need you to stop, so I can start, and I real quick. Patient stops to let me start the line, and once I say I'm done, they start back up. Not a doctor, but a hearing aid dispenser in private practice. Had a patient come in for a hearing test, young guy in his mid-20s, which is already unusual. Main issue is that has getting noise complaints about his music. No issues with his ears physically, so I do the hearing test, basically ends up with a profound hearing loss. Weird because that's basically sign language territory there. I walk behind him and ask him what his plans are for the evening, to which he responds appropriately. Definitely what we call a non-organic hearing loss. He was trying to get the results he wanted to justify being a dick of a neighbor. I had an employee tell me their spine couldn't stay straight, and when they tried to sit up feet flop to the left or right. Followed that up with telling me they found out that this was due to one of their lungs being deflated. You know, because your lungs hold your spine straight. A highlight of my career when he finally quit because he just wasn't about that cubicle life. Patient comes in saying she has terrible abdominal pain 10/10. I say okay and start to examine her. She immediately starts screaming the moment I touch her belly. But look, I've seen patients in terrible pain, and nobody has ever yelled in pain with their eyes up. She wasn't even tensing or anything. It was a really sad case though. She has a history of coming in saying she was pregnant when the urine and blood test was clearly negative. In one case she even tried to steal a pregnant patient's urine. She got caught pretty fast. She was on psych follow-up. Not sure what the diagnosis was, but my guess would have been Munchausen's. Anyway, we sent her home without pain meds. My second patient was a man with a chronic cough. Asked him, are you smoking? And he says no. Examines him, and there's a cigarette pack right in his breast pocket. A doctor had the worst person in the world with fake seizures that could only be cured by Dilaudid, the most potent opiate that can be administered in the hospital. Fourth, usually Seizures aren't treated by opiates. This lady was insufferable, and she knew all the rules. She would make sure her enabling husband IQ 50 came in. So she had a driver, so she could get knocks. If we didn't give knocks, he would shut that place down, screaming and threatening. She would spy the parking lot to see which doctors were working. BC deluded. Well, one day I freaking had it. She had brought her son IQ normal to the air. He had a learner's permit. She reassured me, and she started fake seizing and screaming. I just let her go. Then she got threatening, so I called security, and I was the first person to ever get her removed. She then proceeds to walk out the doors with her son, and not 15 minutes later she is back in the air as a trauma, full collar and all. She says she's gonna sue me, that she went outside, had a seizure, fell, and is in more pain. Deluded. So I stop her right there and walk to security around the corner and look at the security tape. She very clearly looked around, made sure no one was looking, then gently lay down in a mangled position. In the video it looked like her son said frick this, and he literally walks away and walks several miles home. I went and cleared her from her C-collar and backboard after calling police. They came and didn't do anything. She was back 2 days later. Doc, do you need to refill your meds? Part. Nope. Still taking them. I'm asking because I know based off of my prescription that it is time for you to get more. If you don't need more, it means you aren't taking them. Not an MD, but heard this from my physician friend. Known malingerer comes into the air claiming to be paralyzed on one side of her body and demanding stroke meds. My friend examines the malingerer and asks, "Hey, how did you get that bruise under your arm?" Malingerer lifts up her paralyzed arm to look for the non-existent bruise. My friend is very clever. Patient came in with seizures, non-specific weakness, lightheadedness, and numbness/tingling in her hands and feet. She gets admitted because of some electrolyte issues not related to the neuro symptoms. These were corrected later and symptoms persisted. Sure enough, on the second day she seizes. As soon as the diazepam is pushed before the flush is even in, she stops seizing. This happens again 3 hours later. The third time, while she was seizing, we took her hand and tried to drop it on her face twice. Both times she moved her hand out of the way so it wouldn't smack herself in the face. We just stood there until she got tired of shaking. It took about 5 minutes. She left Jammer a few hours later. I went to the ER one night about 3 AM on a Friday with crazy pain right under my sternum. Literally thought I was dying. I couldn't figure out why the doctors and nurses were being so cold. Finally one nurse said, "I can give you Tylenol but not morphine." I said, "That's fine, I'm breastfeeding my son, so whatever I can take to not screw that up is fine." I can see her facial expression totally change. Literally everyone's attitude at a 180 turn. Slow to the take, I start to realize what I look like. Husband sweatpants, messy AF hair, zombie face, oversized sweatshirt and a nursing tank top, super low cut crisscross thing. Turns out I had pancreatitis and had to have my gallbladder removed. And that's the night I found out new mothers look like drug seekers. Had a patient flop around like a fish out of water in my waiting room while shouting I'm having a seizure. People faking seizures is actually fairly common. Smack em with some ammonia salts and suddenly they're fine. Funniest story of my medical school career. We were rounding on the wards for a teenage son whose parents were in the room. Dad, UHH. We saw our son tested positive for marijuana. This is clearly incorrect. Attending. There are some false positives, but the test is pretty accurate. Dad, my son is a lifeguard. He would never smoke. Son, yeah, I've never ever smoked. Looking scared af attending. We can order a more sensitive test that will give more accurate answers. Son, well, I do sit really high up on the lifeguard chair and I think some of the kids around the pool smoke, so maybe I breathed in some of the smoke while working. Team frantically ends conversation to leave the room and laugh hysterically. I'm an EMT, if that counts. So here's a good one. About 85% of the calls we receive, at least in my town, are issues where they clearly aren't severely injured and just think, if I call 911, it'll get into the hospital faster. Pro tip, you still wait like everybody else, unless you're actually dying. Another part of this percentage of people are ones that just want attention/medication. We had a woman recently that decided that she was gonna have a seizure in the ambulance. A real seizure, put simply, usually looks like they're just tensing up and twitching in one position. This lady was flailing every part of her body everywhere and trying to spit everywhere. Not only was it clearly fake, but we had to clean up the damn mess she made. We'd usually let it slide, but I pulled out a nasal airway and a lube packet and said loudly to my partner, we need to stabilize her breathing. I'll put in the airway in a second. Just let me apply the lube so it doesn't tear open her nose like it usually does. The instant I said it, she stopped having her seizure. Unrelated story, but we also had another woman that claimed she couldn't get up after a fall in her house. We arrived to her entire house being locked, so we called through a window that was cracked to see if there was any other way inside besides breaking through her screen. She proceeds to stand up, go to the front door, unlock the door, walk back to where she was, and lay back down. We did a generic checkup and there was clearly nothing wrong. When she said she didn't want to go to the hospital and we were about to leave, she stopped us and asked us to call Comcast for her, since we are the M's and are a higher priority. TL. Doctor, fake seizures and faking an injury, to have him call Comcast for you. Edit. Wasn't clear in first post, didn't insert the nasal airway, just said that I was, so she'd stop faking a seizure and making a mess. An ex of mine told me a story about a dude that had a window wiper handle stuck up his, but because he had one laying in the shower, slipped and fell onto it. It never occurred to her that it might have not been an accident. A nurse, not doctor, and not exactly faking it, but had an unconscious woman brought it by paramedics with blood alcohol level well over 2. She had been found passed out on the floor by the parents of the toddlers she had been hired to watch. They were terribly worried about her, so the staff explained that she was unconscious because of her high blood alcohol level. They asked, completely seriously, what would cause that, because she doesn't drink. Vet student here, used to work as a technician near a major university as I went through undergrad before getting accepted into vet school. The amount of animals, mainly dogs, who would come in with college students on the weekends after ingesting drugs or alcohol the students left out is higher than I would have expected. But the owners won't tell us the animal got into a drug stash because they don't want to get in trouble, even though we know that's what happened because of the side effects the dog is experiencing. But we need the confirmation from the owner. Just tell us. Making up a story or saying something else happened isn't helping you or your pet, especially in life-threatening situations. In order to properly treat the drug/toxicity, we need to know what it is. I promise you, we aren't interested in getting you in trouble, we're interested in saving your pet. Help us do so, and be honest when you visit the doc or vet. PA, not a doctor, and I have a couple, but when I was on my clinical rotations, one of the funny things I remember was on my rotation. A lady was in complaining of some vague, generalized pain. Had a feeling she was malingering. I started a neuro exam and was testing her cranial nerves. Asked her to keep her head still and follow my P. She was clearly focusing on the wall behind me and not tracking my movements. I said again, no, follow the P with your eyes. She said over and over that she can't, and that she's really trying and this must be really bad. So I moved on to another exam, and while talking with her and holding her attention, I walked around her bed from one side to the other. She tracked me with her eyes the whole time. It was the same rotation we had someone feigning seizures in order to get at him. Might have been the same lady on a separate occasion, now that I think of it. I'm a medical assistant. Had this teenage girl, probably 16, come in saying that her wrist was broke. Her mom was behind her rolling her eyes after every time she would tell me how bad it hurt. She then proceeded to flop it in an attempt to show me how bad it hurt. When she did that, she said it was clearly broken and she would need a cast. I said I would take her back and let the doctor do some x-rays and do their thing. The mother asked to talk to me outside of the room, and she told me her daughter's friend recently got a cast and her daughter was notorious for being overly jealous. I just responded by saying that if there were anything wrong, it would show up in the x-ray. Guess what? She didn't get a cast and threw a fit. Last I saw her was her crying and throwing a temper tantrum outside of the waiting room and being dragged out by her very embarrassed mom. I see a lot of pain, drugs, and pseudo seizures in this thread. Since I'm in internal medicine, I saw a patient recently who was like, "Yeah, doc, I take my insulin every day." HbA1c was higher than the lab could measure. The report just says 17%. This dude's blood is basically syrup. FYI, diabetes is diagnosed with an A1c of 6. 5%. Bad as anything. 8%. I once had a patient with an A1c of 13%, and at her follow-up appointment with a neurologist after her stroke he wrote in his note, "The highest A1c I have ever seen." And I was like, lol. I have another patient who told me that he really needed a prescription for marijuana because when he was actively using it his blood sugars were under control. Under control with a HbA1c of 14%. Edit. A lot of people have trouble affording their meds, and I'm very aware that this results in non-adherence. If you are having trouble affording your meds, let your doctor know. There are $4 lists at Target, Walmart, and some grocery chains. Good Recipe is also a tool to help people find affordable meds. Some of my greatest it sometimes feels personal victories have been getting people from poorly controlled blood pressure and diabetes to well controlled because of these simple tools. A friend of mine was a counselor. She was assigned a tough case, a patient who presented as an alcoholic, but who insisted up and down to every doctor/counselor he sat down in front of that he only had one drink a day. I can't remember. Vodka, maybe? He never wavered in that, one drink a day. But he had a lot of the symptoms/life problems of an alcoholic. My friend was the first one to ask, "How big is your one drink?" He admitted it was a flower vase. Not a doctor, but I'm a patient who lied. Before my sobriety I did some doctor shopping. After that got hip I'd have to go around to urgent cares and stuff. I ended up needing something badly so went to my GP. I've been going to him for years, like since I was 18. I told him I was sober and had tooth pain and back pain and other pains and had tried everything against what he was supposed to do. He looked me dead in the eyes and said, "Both of us know what you're saying right now is complete horseshoot." Turns out my doctor was in AA. I ended up leaving after crying for 30 minutes. Got sober within the next 6 months. He goes to my home group and is still my doctor. Edit. This was in 2015. Sobriety/clean date is the 3rd of May 2016. I'm a dentist. We have a drug tracking program shared with any narcotic prescriber that tells me what patients have filled out what. I just need their name and OB. I get drug seekers every now and then with real or fake pain claiming they haven't been taking anything. Quick search shows me the truth. Most people don't know I can do this. Liar, liar, pants on fire. M's here. I had a patient who was pretending to suddenly be paralyzed. Very dramatic, on the floor, saying she couldn't feel anything below her neck. After assessing her, we had her stand and get onto the stretcher, which she did without difficulty, despite being totally paralyzed. In the ambulance, she told me how she sometimes goes code blue, and how if she goes code blue, I must not rub her chest or cause her pain. The best way to revive her was to turn the lights low and talk softly and soothingly to her. She told me all about how she went code blue in the hospital over a dozen times last time she was admitted, and how the doctors were so scared they almost couldn't revive her. During transport, I asked her for her birth date. Her eyes fluttered shut and she didn't respond. We drove in silence for several minutes while I worked on documenting the very detailed and unrealistic history/story she had been telling me. Eventually her eyes fluttered open and her hand went to her chest. She says, "Oh, I think I went code blue there for a minute." I replied, "Nope. No worries, you didn't. You're totally fine and your vitals were pristine. You don't have to worry, you're safe. So what's your birth date?" She looked super annoyed.